for the day. I provide privacy, a little hand hygiene. May I have your name and date of birth, please? Okay. I'll check it with his badge. The doctor has ordered me to do a little suctioning of your nasal, of your pharyngeal or tracheal area. I'm going to monitor your oxygenation status throughout this procedure, as well as I'm going to raise your oxygen right now to kind of hypersaturate you, because during the procedure I'm going to have your oxygen off for a moment. And then a little blanket, a little towel. If there's any coughing or saliva during the procedure, I'm going to put patient in the high Fowler's position. I'm going to check my suction, make sure my suction is functioning and turned on to about 120, and it's readily and easily available, so I'm not floundering for it. Okay, are you comfortable, sir? Do you have any coughing, questions, discharge? You're all good? Okay, I will check my saline, making sure the expiration date, if it's already been open, I know I'm gonna lip it, and remove some material, and then pour from the lip. Look to make sure that there's no debris, discoloration, anything questionable, get a new bottle. I'm going to open up my sterile kit. And I'm going to place some sterile lube right here, and this little spot there. Okay. Then I'm going to take my first glove, where I'm going to have one hand, my non-dominant hand, which is my left hand, is going to be the clean hand, and my right hand will stay sterile. But for right now, left hand is still sterile. Okay. I'm going to take my cup. I'm going to take my solution. I'm going to open it up. I'm going to lip it. And then I'm going to pour about 20-30 mils into my cup. Keep my cup right here. Then I'm going to come back to my field. I'm going to take my other glove. I'm going to step back like I did with the first. Remember, my left hand's going to turn into a clean hand. My right hand's going to continue to be sterile hand. For now, they're both sterile. I'm going to take out my tubing, clean hand for the suction port, and that goes into the nose and trachea will be the sterile hand. Okay, don't want to get too close. Remember, I have my sterile lube right about there, so we're good there. Okay, so I'm going to take my clean hand and I'm going to find my suction, and I'm going to grab my suction, and I'm going to insert my suction securely with the one hand, which is now a clean hand. I'm going to need the hand. Make sure that it works. So I'm going to suction up some saline, making sure it works. Everything's flowing fine. I will dip into my sterile saline, come to my patient, clean hand, sterile hand. I will have removed the nasal cannula just for a moment, have them deep breathe or cough if they need to, and I'm going to insert my cannula and have them cough if they need to. If there's any resistance, I can wait a moment, back up, and then proceed. For nasal pharyngeal, I want to insert my tube 16 centimeters. For nasal tracheal, it'll be 14 to 20 centimeters. And then I'm going to, once I reach there, it should take no more than 10 to 15 seconds. I will take my left clean hand and I will place my thumb on the port and aspirate as I use my sterile hand to come out in a circular motion. aspirating the material. After that's out, I will replace a nasal cannula with my clean hand and assess the patient if they need the procedure repeated, but it should be repeated no closer than 1 minute and no more than 2 times per session. I will also, with my sterile hand, suction up some more saline to clean out my tube and assess the patient if they need further suctioning. And if they need additional suctioning, again, wait a minute. After that minute, I can repeat the process as I had already done with the same tube. But making sure that none of this material will be dragging onto his chest or onto his cheek. So that's why it's so coiled in my hand. And then 10 to 15 seconds. And then I'm going to aspirate coming out. And then we are done. And replace my nasal cannulas. Continuously throughout this procedure, I would be assessing the pulse oximetry of my patient. Things are finished. I will discard my materials, turn off my suction, assess my patient for any concerns, lower the oxygen back to where it had been, depending on our oxygenation status, and put them back in a comfortable position. I would document how the patient tolerated it, time, date, tolerance, and what material, if anything, came up, and any illicit coughing or mucus discharge afterwards. And that's it.